let me show you real quick how you can set up the ethnicity and the race to show. So I don't know if you guys can see that, but where I went is I went to maintenance, configuration, and demographic settings. So if you guys are on any of the 9 series of Practice Partner, you're going to have this ability. So this is not a 9.4 or a 9.5 item. So maintenance, configuration, demographic settings. When you go into demographic settings, you're going to have 4 tabs at the top. You're going to have general, patient, guarantor, and account plan. We're going to be looking for the patient tab. And where you're going to be looking at is the race and the display, or just the race. That's all you care about. And that would show your race and ethnicity. If you want to have that declined option in your race, you're going to have to open up your ppart.ini. Does anybody know what the ppart.ini is? One person. Two. Oh, okay, we got some. I knew 1990. I knew you had to have that. Come on, you have to know what that is, right? So there's the ppart.ini. If you search for the word race in here, it'll find that, and then you can actually plug and play and put that in here. So you can see it says race enabled on. Let me maximize this for you guys. Now I lost it, which is always good. Let's go up. Okay. So you can see I just wrote in declined on here in the ppart.ini, and that's where it shows up in that dropdown. This is actually how you can do that. New site installs or upgrades are going to have this site or this automatically in there. So if you upgrade to 9.5, it's going to pop that in for you. If you want to do it now, what you're going to want to do is go to the other data section, put in an element called language, make it type equal text, make it up to 30 characters, and then it's going to be free text. So you're going to be able to enter that in. And I'll show you how to do that in here in a second. And then I just showed you guys how to configure the race and the ethnicity options in the ppart directory. That'll also be updated if you don't feel comfortable going in the ppart directory and misspelling declined like I did. To add that other data field, go to maintenance, define other data, and then you're going to go to patient. So follow the bouncing ball, and that's where it's going to lead you. So maintenance, configuration, define other data, and patient is where we're going to want to go for this. So I'll go into that, and then what you're going to do is you're going to click New. Since I already have this here, I won't demo it entirely, but in the label, that's where you're going to want to type in the word language here. The description, put in patient's preferred language, or lang. And then the type, just put in text, and then up to 30 characters. So that's all you're going to have to do for that one. Here is the measure. So more than 50% of all unique patients seen by the provider have demographics recorded as structured data. So the big one here is seen by the provider. So it's not all of the patients that you have in your system, not all 30,000, 20,000, however you have. It's just the ones that are coming into the office are the ones that you're going to be checking that over. So if we're talking workflow, if you're going to be checking in those patients, it might be a habit that you have the front desk or the nursing staff or whoever's going to be doing that to check over the demographics, make sure that those are in there, and put in the necessary items. Here's the denominator for this one. So the set of individual patients for whom there is at least one clinical encounter, so that's where we get the patient seen. This is what a clinical encounter is. So the encounter provider is the provider for whom the measure is being calculated, of course. The office visit where the encounter date falls. I told you I got dyslexia here. And then unique patient count where you can actually do the patients that are seen. Here's the numerator, number of patients in unique patient set for whom values are currently exist, and then these are the things that they're looking for. So gender, preferred language, race, ethnicity, and date of birth.